Video is about when to deliver an obstetric patient, because depending upon different obstetric reasons we deliver different patients at different time, and different exam questions come related to this topic. Okay, so for instance, let us take question number 1. A patient with a previous 1 cesarean section presented for repeat cesarean section, and she has last scan done at 22 weeks of gestation when her ultrasound parameters were appropriate to date. At what week of gestation would you do her cesarean section? Now we have different options like 39 weeks, 40 weeks, and amniocentesis for lung maturity. Okay, so this is one question. We will tell the answer in the end of this video. Question number 2 is a patient had GDM and her sugar levels have been well controlled on insulin. When to deliver the baby? Okay, there are different options: 37 weeks, 38 weeks, 40 weeks. Okay, we will tell you the answer in the end of this video. Now, one thing I would like to tell you is that monochorionic twin uncomplicated pregnancy needs to be delivered at 36 weeks of gestation. All these facts have been taken from the relevant sources like RCOG guidelines and talk articles and different other authentic sources. Okay, so monochorionic twin uncomplicated deliver at 36 weeks. But if monochorionic twin pregnancy is complicated, then deliver at 32 to 34 weeks. And if monochorionic twin pregnancy previously complicated by TTTS, then deliver at 34 to 36 weeks of gestation. Now coming to dichorionic twins. Dichorionic twins need to be delivered at 37 weeks. Triplets needs to be delivered at 33 weeks of gestation. The reference is Dewhurst. Now, Trichorionic Triamniotic Twins after a course of steroids needs to be delivered at 35 weeks. Quadruplets needs to be delivered at 31 weeks. Confirm Placenta Previa, in which definitely we do LSCS, needs to be delivered at 34 to 36 weeks. By confirm Placenta Previa means if by any means like ultrasound, MRI or any other means before complications, if we find out that patient has got Placenta Previa, then elective LSCS is done at 34 to 36 weeks. But in most of the cases, Placenta Previa is diagnosed at the time of delivery, after rupture of membrane by fetal heart rates dropped, or whether artificial or spontaneous. If heart rate drops after the rupture of membranes, then Placenta Previa is suspected. Now, Placenta Previa, if it is uncomplicated, then deliver at 36 to 37 weeks. But if it is complicated by PU bleeding, then deliver at 34 to 37 weeks. Now, coming to the chronic hypertension in pregnancy, after 37 to 38 weeks, we usually make a plan for the delivery of chronic hypertension in pregnancy. But if a patient is with chronic hypertension and age is more than 40 weeks, then deliver at 40 weeks, means do not wait for 41 weeks. But if patient is low risk with a chronic hypertension, then we can wait for 41 weeks. In case of the PIH, we deliver the patient after 37 weeks. We do induction of the labor. We do not take it beyond the term. And if there is preeclamptic toxemia or preeclampsia, then deliver at 37 weeks. And if you have severe preeclampsia, then 34 weeks is the time of delivery along with the steroid cover. Now, type 1 selective growth restriction patient with a monochorionic pregnancy, deliver at 34 to 36 weeks. Type 2 and type 3 selective growth restriction in the patients with a monochorionic pregnancy, then deliver at 32 weeks. Now, when to deliver based on the Doppler result: reverse diastolic flow, deliver at 32 weeks, absent diastolic flow, deliver at 34 weeks, and ST ratio abnormal, 37 weeks is the time of delivery. Elective repeat cesarean section normally is done at 39 weeks. Means if the patient comes with a previous 1 score, previous 2 score, then give the time of the delivery at 39 weeks. This was in MCQ, which I have mentioned in the start. So in the end, the answer would that be 39 weeks. But elective cesarean section, if we plan it for uncomplicated singleton pregnancy, then 38 weeks, and uncomplicated twin pregnancy, then 37 weeks. Diabetes mellitus, control on diet without insulin, then 40 weeks. But if we have pre-existing diabetes or GDM, control on insulin, then deliver at 37 to 38 weeks. Now coming to the answer 1, okay, the question I have told you before, previous one scar, and in that the mode of the time of delivery would that be 39 weeks. Okay, now coming to question number 2, I have explained the question number 2. The answer of that is 38 weeks, because I have told you that if the sugar is controlled on insulin, even if it is GDM, then you have to deliver at 38 weeks. If GDM is controlled on diet, then we can wait for 40 weeks. But here it is controlled on insulin, so we have to wait for 38 weeks. Okay, thank you so much. These are few